Please refer to important safety information at the end of this video and the accompanying patient medication guide located near the monitor.
My story? I'm a former tomboy who grew up to be a model. Everyone has a story. And everyone should feel free to reveal their story. I want to tell mine without having to worry about my frown lines. So I talked to my doctor about Dysport.
Dysport is a prescription injection for temporary improvement in the look of moderate to severe frown lines between the eyebrows, glabellar lines, in adults less than 65 years of age.
Frown lines are just not me.
Dysport may cause serious side effects that can be life-threatening, like severe problems with swallowing and breathing. If you already have these problems before receiving Dysport, you're at the highest risk of complications that may be fatal. Don't have Dysport treatment if you are allergic to Dysport, any of its ingredients, any other botulinum toxin product, cow's milk protein, or have a skin infection at the injection site.
My doctor and I talked and we decided that Dysport was right for me.
Tell your doctor about your medical conditions, including a disease that affects muscles and nerves like Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome. Any side effect from any botulinum toxin product in the past, a breathing problem like asthma or emphysema, weakness of your forehead muscles like trouble raising your eyebrows, drooping eyelids, or any change in the way your face looks. Tell your doctor about all the medicines you take and if you are pregnant or plan to become pregnant or breastfeed. The dose of Dysport is not the same as the dose of any other botulinum toxin product. Within hours to weeks after treatment, Dysport may cause loss of strength or general muscle weakness, blurred vision, or drooping eyelids. If any one of these happens, don't drive, operate machinery, or do other dangerous activities. Ask your doctor about Dysport. Typically, your doctor will first examine your muscles that cause frown lines. Dysport will then be injected into 5 sites above and between the eyebrows. Treatment usually takes 10 to 20 minutes. How does Dysport work? Over time, the muscles above and between the eyebrows repeatedly contract and tighten, causing wrinkles. Dysport blocks the nerve signal that causes these muscles to contract. This reduces the muscle activity in the treated area, ultimately giving your skin a smoother appearance than before.
I didn't want to change my looks, just my frown lines. Now my eyes tell my story, not the lines between them.
What about your story? You're here today. Why not talk to your doctor about Dysport right now? For special offers and more information, visit dysportusa.com. Please refer to important safety information at the end of this video and the accompanying patient medication guide located near the monitor. Dysport is a prescription injection for temporary improvement in the look of moderate to severe frown lines between the eyebrows, glabellar lines, in adults less than 65 years of age. Important safety information. What is the most important information you should know about Dysport? Spread of toxin effects. In some cases, the effects of Dysport and all botulinum toxin products may affect areas of the body away from the injection site. These effects can cause symptoms of a serious condition called botulism. Symptoms of botulism can happen within hours or days to weeks after injection and may include swallowing and breathing problems, loss of strength and muscle weakness all over the body, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, or loss of bladder control. Swallowing and breathing problems can be life-threatening, and there have been reports of death. The risk of symptoms is probably greatest in children and adults treated for muscle spasms, particularly in those patients who have underlying medical conditions that could make these symptoms more likely. The toxic effects have been reported at doses similar to those used to treat muscle spasms in the neck. Lower doses in both approved and unapproved uses have also caused toxic effects. This includes treatment of children and adults for muscle spasms. These effects could make it unsafe for you to drive a car, operate machinery, or do other dangerous activities. Do not have Dysport treatment if you are allergic to Dysport or any of its ingredients. See the end of the medication guide for a list of ingredients. Are allergic to cow's milk protein, had an allergic reaction to any other botulinum toxin product, such as Myobloc, Rima botulinum toxin B, Botox, onabotulinum toxin A, or Xeomin, incobotulinum toxin A, or have a skin infection at the planned injection site. The dose of Dysport is not the same as the dose of any other botulinum toxin product. The dose of Dysport cannot be compared to the dose of any other botulinum toxin product you may have used. Dysport may not be right for you if you have surgical changes to your face, very weak muscles in the treatment area. Your face looks very different from side to side. The injection site is inflamed. You have droopy eyelids or sagging eyelid folds, deep facial scars, thick oily skin, or if your wrinkles can't be smoothed by spreading them apart. Tell your doctor about all your medical conditions, including if you have or have had a disease that affects your muscles and nerves, such as amyotrophic lateral sclerosis, ALS or Lou Gehrig's disease, myasthenia gravis or Lambert-Eaton syndrome, allergies to any botulinum toxin product, or had any side effect from any botulinum toxin product in the past, a breathing problem such as asthma or emphysema, swallowing problems or bleeding problems, diabetes, a slow heartbeat or other problem with your heart rate or rhythm, plans to have surgery, surgery on your face, weakness of your forehead muscles, such as trouble raising your eyebrows, drooping eyelids, any other change in the way your face normally looks, are pregnant or plan to become pregnant, or are breastfeeding or planning to breastfeed. Patients with a disease that affects muscles and nerves who are treated with typical doses of Dysport may have a higher risk of serious side effects, including severe swallowing and breathing problems. Human albumin. This product contains albumin taken from human plasma. Steps taken during donor screening and product manufacturing processes make the risk of spreading viral diseases extremely rare. In theory, there is also an extremely rare risk of contracting Creutzfeldt-Jakob disease, CJD. No cases of spread of viral disease or CJD have ever been reported for albumin. Allergic reaction to injecting in the skin. It is not known if an allergic reaction can be caused by injecting Dysport into the skin. The safety of treating excessive sweating with Dysport is not known. Common side effects. The most common side effects are nose and throat irritation, headache, injection site pain, injection site skin reaction, upper respiratory tract infection, eyelid swelling, eyelid drooping, sinus inflammation, and nausea. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal and other natural products. Using Dysport with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you've received Dysport in the past. Especially tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as MyoBlock, Botox, or Xeomin in the past. Be sure your doctor knows exactly which product you received. Have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, or take a sleep medicine. Use in specific populations. Dysport should not be used in children or in women who are pregnant or breastfeeding. Ask your doctor if Dysport is right for you.